isolated at GMH were allowed to go home and self-quarantine, and it was kept from the public. Let's just start right there. What are your thoughts on that?
Sure. Yeah. It was we learned the same way the public learned by seeing a news interview and seeing the GMH director kind of just say, "Oh, we have this many in home isolation." And so my vice mayor, called me and he goes, "Did I hear that right?" I said, "I don't know. Why don't you post it into the emergency ops chat? We all, we're all in this chat," and asked the question, and he did. And it came back. People are allowed to be at home isolation, and that kind of where we started all panicking and started saying, "Well, what's really going on?" We weren't told. We thought the word isolation means they're in some kind of facility somewhere, and we didn't know that was an option. Why are we giving them an option? So that just kind of run its course, and so we were trying to figure out where these things are and who these people are, because it's showing. Last night's results show that they're being exposed to the community, and the numbers are jumping. So we're very concerned about it, and we're still waiting for the answers.
Right.
So there's been no communication since Saturday?
We did chat. We talked about other things. They said, I think the next day they said they're gathering the home isolation ones and bringing them to the skilled nursing unit. So we're just waiting to see how many are actually there. We asked how long it would take. They said that's what they did all day Saturday. So we were like, okay. So were we comforted by knowing it? Maybe. We kind of want to see where that is, and we're saying just release to the public that all 12 at the time or whichever else are now at the SNU facility or a facility that's away from the community.
Right, Mayor. And so the response from the administration when they finally got around to addressing it was that this was a temporary measure.
Yeah, and I understand it is a CDC recommendation. I mean, they're doing it all over the world, and I guess that's the normal practices for them to be at home, which, okay, we kind of, but if I would have said, just tell us earlier if that was the case on that end. But
just be honest at all times, right, and put out the info that people need to know.
Yeah, and I have friends actually from around the world. I have actually some friends in China, and they were saying that, they kind of said, don't do that. Don't do home isolation. That's why they were able to get ahead of it in China, is because that's how they built all those hospitals, is to get everybody away from everybody. So they're like, home isolation, not good. And I'm like, okay, you're scaring me more, but let me figure this out. And so, I was like, saying maybe we should reconsider this. And so I'm kind of glad the administration did reconsider and brought everybody into that is showing signs. So the fact that it jumped so many yesterday, it kind of gets me worried about how many more areas we actually have to be able to do that. And will they be, commandeering some other areas or using some other facilities to get the growing number? But if it is a practice, that's we want to make sure, because I would say I trust the people who are at home isolation, but it's hard, and you don't go around telling people you have something. And kids are very quick to run up to people who are, even our uncle, they run up to hug him and kiss him, and we thought, oh, wait, stay away because I'm sick.
Right.
And so sometimes that quick interaction and the people who are are concerned for the people who are caring for them, their caretakers at this time. So it is very alarming for us.
Yeah, and then to get the info after the fact, and for them to kind of play damage control with this. There's too much damage control going on with some of the information that's coming out. But for them to say, "Oh, public health was checking on them," I want to have faith in the government's response, but there's just been too many missteps and too much misinformation for us to have that kind of faith. And now we're seeing the evidence of the community spread. And so obviously we can definitely understand why you're concerned. Mayor, there were some privacy issues we talked about last week. Knowing that we had positives in the villages home isolating, people knowing this, I think if people knew that, maybe they would start taking this mandatory social isolation order a little more seriously.
I agree. I think I think they're starting. We saw the thing last night. They're trying to trace back people who attended certain places, and I'm like, okay, that's 2 cases out of how many, and that's one area. Where else did they go? And that was something we discussed last night in our chat. We said, where else did these people go? So we can help. We're here ready to help. We can help public health with background tracing and everything. And I'm sure that as of last night, as the numbers grew, that specific area of public health. I know everybody from all the different divisions are helping out, but I'm pretty sure they're going to be overworked and understaffed because it ramped up so much. And back tracing is pretty hard and it's very detailed. So they're trying their best to kind of go and see. So we share the concerns of the public.
Mayor, I think we're just sorry, Rita. Go back to we were able to obtain some screenshots from this chat, and I felt like one of the things that really, really troubled me was relaying of the information that the Homeland Security Advisor Tim Uggan had instructed people at the JIC to not release this information to the public.
I don't. Yes, the snapshots were there, but I don't know if that's Tim Uggan's actual words,
right?
Per se, or he was actually there. I don't know if he was there or in the meeting, but that's what the impression of our staffer there at ESF,
right?
Emergency Services. I think that was his kind of impression of, because he got the pressure because his job is to relay the messages back to us as we get.
But only some messages, apparently.
Right. And this is exactly what the response activity coordinator for the Mayor's Council of Guam wrote back in this particular chat. Please note that I have met with Mr. Tim Uggan, and I quote, "We do not want that information released for obvious reasons. Also know that public health is monitoring those who are self-quarantined."
Yeah. So it's unfortunate. I mean, this is one of several chats that we are all on. This chat, usually we use it for the siren testing. So that happens every first of the month and stuff like that. So it's just, everyone's just, we're flooding every chat that we can, that we have people who are willing to listen, saying, these are the questions and concerns we have, because after these releases come out, we know it's lacking certain details that the public wants to know, and that's kind of what all we're asking for. Is,
I mean, not just you guys. We saw, what started with the media, making inquiries and talking about lack of timely information, the lack of correct information, snowballed into residents and to mayors and to doctors by the end of the week, and even into senators writing letters calling the administration to be more transparent in its release and what it's releasing to the public.
Yeah, and I think that's, we're in communication with some of those doctors already. We agree with their asks, what they're asking for, that, is within reason. And we know that. And so we're just trying our best to see what we can do to help. People are saying, why does the governor put the whole island locked? I understand there's a whole other things. It's not even working in the States. People have personal freedoms and liberties and all these other things. But I think, by just announcing the villages and saying where they either worked, where they were visited, if they know, it's a lengthy process, but at least release that information, and then we can kind of go from there to see, because, everyone's trying to figure out will the government reopen on March 30th? And
I don't think so.
That's a huge, big question mark right now in everybody's mind. It's like, so at this time, and starting today with the lunches, we're going to have more people out on the roads again. So
right. Yeah. Mayor, this mandatory social isolation order, just standing it up over the weekend, I can see already that there are too many exceptions, that people are not taking it seriously. What we're seeing is people are going to Kmart, they're going to the grocery store, not because they have to, but because they can.
Yeah, and I've seen people buy things that are not necessarily. I was doing plumbing repairs. I was like, okay, I need to do it because I don't want my water bill to shoot up in the middle of this. But I did that, and I noticed so many stores open on the way to the, to the hardware store to get it, and I was just like, wow, how is this a essential, business to stay open? I understand business owners are trying their best to kind of make and pay the rent of the subjects, but it became just very evident that people are not paying it, not listening to the order. So it doesn't really help if only 60% of the island's doing it and everybody else is still.
Oh, that's a high estimate, Mayor.
And I think what we need to remember is that we just need to, going forward, just act as though everybody has been exposed. I mean, that's just really what we have to do at this point.
Yes, I'm asking my wife to stay home and work because, she works for the federal government on it, and they're still being called in. And I'm just like, man, I prefer that you stay home for 14 days here at least, because, we're trying to get our bearings on what's going on
And
here.
I think that's what's happening now, Mayors. We got a lot of questions. We're trying to let public health go out there and do their job, but we're wondering about the trace investigations into the flight that came in with the, I think it was 2 infected patients, So there's that investigation, right?
And that was the thing. Also in that chat, I said, why are we, putting these people from the flight to the Philippines who've not been tested into isolation, but we're letting people with positive cases out and about back to their homes, and we don't know their homes. You know, I would feel more confident if that home was checked out by somebody, and they're, you know, the people are going to be caring or saying, here's the sanitation procedures of how to keep somebody who's asymptomatic and healthy. I understand, you know, that we don't want to stress the resources at GMH. We need the beds for other things. It's not just COVID that the island's dealing with.
Right.
And I would be pretty pissed if my parents or grandparents needed a bed for something really urgent, and then there was, you know, there's a healthy person being isolated there. So, you know, use another location to isolate somebody who's healthy, but free up the beds at GMH. So I understood that later on in the conversation, but at the time it was the jaw-dropping moment for us. We're like, what? Really? Does the public know? And
Right.
people were
Yeah.
like, well, they knew it was me because I used the word Lordy a lot. So they're like, we knew that was you. That was an authentic text message. And I was like, oh, really? I said,
Right.
I don't really catch myself. And I WhatsApp checked if I wrote the word Lordy, and sure enough, I wrote it like,
You know, I use that word a lot too, so we have something in common.
I do now.
Yeah, now Lordy was the word of the weekend, Mayor.
Oh,
I call it Lordy.
there you go.
Man, we want to thank you, mayors, for, you know, speaking out and kind of letting us know what's going on in the villages. Definitely don't want you guys to be overlooked, and, you know, be safe. Mayor, is there anything else that you have going on in the village or with the mayor's council that you want to?
Pretty much all the mayors. Our task right now is we've been out for the. I mean, we're actually activated. We're working. Our job is sanitation and cleanliness and decontamination. So wherever we have, so a lot of us have done that already for our Manamco centers. They're done. They're sealed. They're ready to go for whatever things, and then a lot of us are just cleaning the facilities that need to happen. And so today starts the hot meals for the senior citizens. Mm-hmm. So about 800 will be getting served meals. This is going to be a logistics issue for us. We're assisting public health in this issue. So hopefully we're not going to be exposing and spreading. So we're going to try our best to do infection control and get these meals to the seniors. And at the same time, DOE is doing theirs. So some of the mayors will be assisting with traffic control for the school sites.
Wow. Yeah, so definitely a busy day for you guys. Mayor, wash your hands, be safe, and, you know, wear your gear.
You too. Take care.
Okay, Mayor.
All right, take care.
Bye-bye.
There you go, Mayor Robert Hoffman. And kudos to the mayors. They have been out here, you know, making noise, putting their concerns out. 637-0094, that's our